Okay, good morning. Morning, everyone. I'd like to thank Dr. Silva for inviting me to give a talk. I know he was very apologetic because I had a fall. Everybody keeps asking me, how did you have a fall? My usual answer is that I was chasing a young man and couldn't catch up. And the result was 3 broken bones at my ankle. So one was totally crushed. So being a breast cancer survivor, one of the issues is also having had breast cancer diagnosis at a young age. I developed osteoporosis much younger than what it should be. So because of that, I have these problems, and I keep challenging the doctors, do you have any protective mechanism, you know, like Robocop type of things that we can wear so that even if we fall, we won't have a problem, we just get up and start walking. Okay, so besides that, I would like to talk about advocacy in cancer in Malaysia. And this is actually under Together Against Cancer Malaysia, which we call TAC. A number of you are members of TAC here, I think, in this room. I would like to say that TAC is actually an organization that is started mainly to do advocacy in the country, to try and look at access for cancer care in the country for people. I think very much related to what Nirmala spoke about this morning, that we're talking about in terms of cancer, access to cancer care. Next slide, please. So TAC was actually registered in the year 2014, in September 2014. It's not very long ago. And some of the things that we're looking at under TAC is communicating with the Ministry of Health with regards to access to cancer care in the country. Communication with Ministry of Finance. Most of the time we tend to focus on Ministry of Health. I think we need to also focus on Ministry of Finance because that's where the money comes from. And issues like GST and budget and stuff like that. And also I will talk about activities within TAC in the year 2015 and so far within 2016 itself. Next slide, please. And so Together Against Cancer Malaysia, we registered in 2015. And what happened in TAC was that, it was 2015 September that we registered. And within those few months until now, we've been quite actively doing things, communicating with the various authorities about access to cancer care. And majority of us in TAC are cancer survivors. And we also have healthcare professionals who give us the support, provide us with information, and we have discussions among ourselves, and then we go on to communicating with the authorities. Next, please. So, as you can see here, communication with Ministry of Health. We actually had discussions with Ministry of Health, and over here in this picture is the Director General of Ministry of Health, Dr. Hisham, if some of you know him. And you can recognize a few people seated around that table. We went to his office to discuss with him, and this was before we were registered. This was in 2014. And we asked him for a cancer drug fund to be set up for people who cannot afford. And he took us on a wild goose chase. And he told us, why don't you go and set it up yourselves? So in advocacy, many a times, the answers would be no 90% of the time. And you have to persevere, you have to keep at it, you cannot give up, and we decided that we will keep at it. Next slide, please. Then we went to meet the Minister of Health. We said, okay, DG doesn't want to listen, let's try the Minister of Health. And what we did here was we not only met up with the Minister of Health, and we found that the Minister of Health was much more receptive to what we were talking about, and he was more understanding about the situation, and he did agree with us that this is an issue and that something has to be done about it, and he's really literally scratching his head as to how can we go about doing something about this. And what we later did also was to write to the Prime Minister's blog on the budget in 2016, requesting the government to set up a 50 million ringgit cancer drug fund, which has not happened. We do it at every budget. We keep sending the message. What we want is we want more numbers. We want more people to write in the Prime Minister's blog asking for the cancer drug fund to be set up. The more people that write, the faster, the earlier you will get it. You know, like your child keeps screaming and yelling for ice cream. After some time you get fed up and you give them. It's the same system. Next, please. So other areas that we worked on has been when the Prime Minister announced the GST even on drugs. And we then wrote to the Prime Minister, not just on his blog, but he also put it out in the newspapers from TEC, that we want cancer drugs to be zero rated for GST. There should be no GST on cancer drugs. And next. So what happened was, in 2016 National Budget announcement, all medicines under the poisons list A, B, C, D, whatever they are, will be GST zero rated. But what we knew was that cancer drug funds were zero rated for GST. So that was a one up. You know, you do so many things and you get one small victory and you feel good about it. So that was a feeling of a good, feel-good factor for us in TAC, that something has happened. And we know that we can keep pushing for things to happen. Next, please. And with regards to insurance coverage in cancer care, we are in ongoing negotiations with SOXO. SOXO actually does cover for people who are working under them or retirees who've paid for SOXO before. They actually cover them for various things in medical care. But what we did was we did a comparison of cancer treatment versus other types of treatment like dialysis and stuff like that. The amount that is being used under SOXO for cancer treatment is far less compared to other diseases. So we are in negotiation. The negotiations are ongoing with SOXO to try and increase the amount. And we also had discussions with Bank Negara, who are actually responsible for being the regulators for insurance. Do you know that? Yes?
Yeah.
Yeah. They are not the regulators anymore. They don't regulate. And that was news to us. Okay? What they do is that they just look at the packages to make sure that the insurance companies that have got similar packages, that there is not too much discrepancy. The other thing is that they have a complaints division where you can go and complain in case you were supposed to be covered on something and you were not given. Those are the areas that they handle. All right. So we then had discussions with insurance companies regarding better packages for medical insurance. But we realized that medical insurance in Malaysia is not designed in Malaysia. It's imported from overseas. The designers are from overseas. So like you have the Swiss insurance designers, the Malaysian insurance companies actually take from there. There is no packaging done here. There's no designing done here. So that's the other thing. So we actually, if we want to negotiate for better deals, we have to negotiate with the international ones. Next. And there was a time when there was an announcement that they may cut the budget for medical care. Did you hear about that? Health Ministry. And this is when we sent a message out to tell the government not to cut the budget for cancer care. If you don't fight for your pie, you will not get it. Somebody else will get the larger share of the pie. So we as cancer survivors, should we not unite together?
Yes.
If not for ourselves, at least for our future generations?
Yes.
So do become a member of TAC so that we can have a louder voice. We need that. We need that loud voice to be able to be heard by the ministers, by the policymakers, by the Prime Minister, make them feel guilty, tell them we want more, that's what we need to do. And so what we did was we had put out things in the press. Besides going on the blog. Besides doing it through social media, we were also putting it in print media. Next, please. Activities that we did, other activities that we did in 2015, we had a forum on Let's Talk Cancer for cancer survivors and caregivers in December last year, and 140 people attended. I think some of you were there, and some of the topics were quite close to the advocacy issues that we brought up, and we talked about some of the discrepancies that we have in the country. And we also had a meeting, some of my colleagues here, we had a meeting with the Pensions Division of JPA in Putrajaya. TEC is actually working out a workable and effective and efficient proposal for treatment coverage for pensioners as well. Because if you ask pensioners, you think that on the whole they're totally covered, but they're not totally covered. So those are some of the areas that we are also trying to work on with the pensions people. Next, please. Then we had a visit to IKN. You can recognize quite a number of us over here. The visit to IKN. You can see Dr. Gerard there. Can you see Dr. Gerard Lim? 1, 2, 3, 4, 5, fifth from the right, standing. He looks quite, because I think some of them really gave him hell when they talked, asking questions about, you know, you've heard of people going to India for treatment, getting their drugs in India, yes? Because it's cheaper there. So those questions were asked. Well, why don't you get the drugs from India to bring them here instead of people going to India? Well, we are cancer survivors, we just ask questions, you know. We don't care about policies, we just want the medicines. So those were some of the issues that came up, and people were asking questions, and they were saying, you know, why don't you make it affordable for us? And I think it was a very good session where people could actually talk openly to those who are in authority and ask and tell them about the patient's point of view. Most of the time the discussions are among policymakers, among healthcare professionals, and survivors don't really get the opportunity to come up front to say things to policymakers. So this is a good opportunity, and people actually did verbally put out their points. Next, please. Internally within TAC, we are actually doing training, which is actually what we call Malaysian Experience Exchange for Patient Organizations, MIPO. Here it is training in creating empowerment and advocacy for patient organizations. We have done it already in Sabah and Sarawak, and we will be doing within this year in Johor for the southern region in the peninsula, and Kuala Lumpur and Selangor, which is central area for the central states, and Penang, Perak for the northern states. Either it will be in Penang or in Perak. So here we try and encourage patient organizations, cancer survivors, healthcare professionals, and interested individuals to come forward and to get some way of how they can do advocacy. So if you look at Sabah and Sarawak, you know that Sarawak had elections recently, and a task force, after the training, a task force was formed in Sarawak to talk about getting a hospital, a cancer treatment hospital in Kuching, and satellite hospitals around to support this, to support the public. So the cancer treatment hospital actually has already become a promise that it will come up. Next. This is a book that we have done. It's the story of 10 patients, just as a sample stories of people to get their response as to how do they rate the healthcare services in Malaysia through their own experiences. So some were good ratings, like in the sense that they said that the teaching hospitals provide much better care. Some had bad ratings. You know, the Ministry of Health has got problems. Some had good stories about Ministry of Health. So it's a mixture that we got. And it is a very balanced mixture that we got. Now this book is going to be launched very soon. This actually has information inside. This book has other information like the action study that Nirmala was talking about earlier, and various other articles that we have inside. And this, we are going to have a launch by somebody renowned, and we will use this as an advocacy tool to the government, because this is where people talked about how expensive treatment had become for them, particularly life-extending drugs, the area of life extension. So people, if they're making choices to have a life-extending drug, are they going to get it or not? Next, please. So what is the advocacy climate in Malaysia like? How many of you will be willing to come forward and speak up to policy makers? Can I see a show of hands? Oh, I better put my hand up because this is the typical Malaysian attitude. Let others talk, why should I say anything? Okay, so if this is the climate, there is nowhere we were going to go. All right. The show of hands was, I think, 2% of this crowd. There is no way. Are you willing to make changes for your future generation, or are they staying overseas or what?
Yes, then the government is not listening.
Government not listening. How do you make the government listen? So that's the most important thing.
Raise your voice.
Go for protest.
You don't have to protest.
Then how?
You can just sit and chat with them. They wouldn't know what we want unless we talk to them.
No, would they see you? Would they be? Go ahead.
Yeah, because we asked to see the minister, we were allowed. Although we waited from 2 o'clock to about 8:30 at night, but we managed to see him. He's not sitting free, he's also busy, So, yes, they are willing to see us, but we must make the first move.
What's the end result? The end result is
GST zero rated. End result you're not going to get in 1 or 2 days. It might take years, but we must continue. Am I right?
Yes.
Okay, can I see a show of hands?
okay. That's good.
Do we have their registration? Do we have their registration details? Jasmine? Okay, we're going to get in touch with you very soon. But no noise making, because I don't believe in that. We shouldn't make noise. We should be a civilized people. Let's talk, If we don't get the ice cream, it's all right. Maybe next year we get the ice cream. We keep talking about it, yeah? Okay. So the advocacy climate in Malaysia is very mild. It is not aggressive like in certain countries. And I think that's how we are. And I think we should continue that way, So that's important. And bringing things to the table with facts, with information, and work around it. Don't forget, if you are the Minister of Health and you're given only this amount of money, you have to decide where you're going to put it. And we have to look at it from their point of view as well. Next, please. So the advocacy in access to cancer care continues. Life-extending drugs is one area that we would like to work on, and oncological services in hospitals in every state with in-house oncologists and radiotherapy services. Very recently, I had discussions with some healthcare professionals about this issue, that, in other states, we are very lucky we're in the Klang Valley, but when you go further out, you won't get anybody there. There won't be oncologists, because the majority of the oncologists are in private sector, all right? But there are ways of doing it. What are the ways? There could be shared services, there could be outsourcing that the government. So if you could go to Penang and somebody in Penang needs radiotherapy in the government hospital, it is outsourced to a private hospital. The government pays to the private hospital so that the patients can go for radiotherapy there. In the same way, it can be done for oncologists as well. Now, a couple of examples, because I had situations where, you talk about prostate cancer and services and screening and stuff like that. Nirmala talked about mammography screening issues and all. This is on behalf of Breast Cancer Welfare Association, when we talked about years ago about mammographic screening for women, because Ministry of Health does not provide screening. Their reason is that they'll open floodgates. No country will have floodgates if the Ministry of Health says you can come into our hospitals for mammography screening, because majority women won't go for mammography screening. Maximum 15% will go for mammography screening. So you still won't open floodgates. But we have private hospitals, and all these happen through Ministry of Women, Family and Community Development. Look at other ministries. Don't just keep focusing on Ministry of Health. So we focused on we asked Ministry of Health, they said, no, we don't do screening. So we went to Ministry of Women. We said, you don't want your women to die, let's have, mammography screening. They said, okay. They asked the Finance Minister for money. Who's Finance Minister? Prime Minister, right? So you ask the Finance Minister to give the money. So Finance Minister wants some, brownie points. Okay, budget time, make announcement, 4.3 million I give for mammography screening. Actually, those are the opportunistic times that we try and utilize. So prosthesis, breast prosthesis subsidy is given through Women's Ministry as well. But we've got another battle to fight. You know why? Because all these two subsidies are terminating this year. So the battle continues again. We start all over again. Okay? So with that, I would like to say, next slide please. Let's hope there are greener pastures in the future. Thank you very much.
Thank you. Thank you so much for the talk. So, I guess we can allow one or two questions if anybody has questions to ask her. No questions?
Yes. Yes. Can you speak in the mic? I can't hear very well. You don't need a mic. I need the mic because I need to hear you speak through the mic.
One of the biggest development, I would say, in US is this thing called moonshot by Joe Biden. His son, I think 35 years old or something like that, died, and Obama put him to do this project called moonshot. It's basically like what JF Kennedy did for going to the moon. That's why I call it moonshot. So this is a real positive development for cancer treatment and cancer diagnosis. Of course, people who are survivors like me, we feel that this is something very, very good thing to do. So this is some of the things maybe we can think of, from an advocacy group. Yeah. Unfortunately, nobody's dying.
Nobody's dying. Even if they die, they won't do anything. Okay. I understand your point. The moonshot part, which was like Tun Mahathir, when he had his heart problem and he had his surgery here, and he was probably one of the first few in IJN. All right, that's what you're talking about, right? We had a very good example. We had the Prime Minister's wife who had breast cancer. But where did they go for treatment? So you need the money. So we're going to say, what happened was the other breast cancer patients started to say, I don't have the money, I'm probably going to die because I can't go to that country. What we need is exactly what you're talking about, is someone does it here. In the US it's easy because they can't go anywhere else. That's the highest resource you can get in the world, so and also the lowest resource in some ways. So the thing is that you need that. I agree with you that we need a champion from the leaders of the country.